I'm Dr. Manuel Astruc. I'm a board-certified psychiatrist. I help entrepreneurs who are suffering from depression get back to being energetic, productive, and very confident. I want to talk about bipolar disorder because it's one of the two big branches of mood disorders. We have unipolar depression, that's bucket number one, branch number one. Let's keep our metaphors consistent here. And there's bipolar disorder, which is bucket number two or branch number two. Bipolar disorder is different, not because it doesn't have depression. A lot of people with bipolar disorder have significant problems with depression, but it's diagnosed based on having at least one episode of mania. Now, I'll talk about mania in a minute, but let me tell you a story of what I found when I started treating patients as outpatients who were coming in with depression. So their presentation, their story when they came in, like, hello, why are you here to see me? And they'd say, I've been having problems with depression. And I would get a history from my clients, the patients, and I found this over and over again, and it was so interesting. I would track back depressive periods, so periods of time when someone's difficulty in functioning, decreased mood, less energy, hard to get things done, would track back to, let's say, high school or college. And the story people would talk about was that they would show up, they would be pumped up to, do well in school, and then they would have a hard time. They weren't doing their homework, they weren't studying ahead, they were having a hard time, they were isolating. Maybe they were partying a fair amount, but there was clearly this decrease in their ability to function, a lot of shame and guilt around this. But what they knew based on their history was that these episodes of I can't get stuff done, that it would switch, and that at some point they would turn it around and they would get energized and they would sprint and catch up, and then they would probably crash again. And these patients were talking about these cycles that were going on for years before they came in with their current episode of depression. And they may never have had a humongous manic episode, right? A big manic episode is something that my grandmother could diagnose from across the street, right? It's very evident that someone's talking very fast, impulsive, not themselves, making risky decisions, oftentimes very grandiose. They can be very elated, they can be very irritable. So they're not having that, but what they're having is these episodes of recurrent depression with these low-grade ups where they just catch up. And now the patient is in front of me, and the question is, what's the diagnosis? Is the diagnosis depression, or is it bipolar disorder? And oftentimes, the diagnosis that I come up with for these patients is bipolar type 2. So bipolar type 2 is different than bipolar type 1 based on the size of the mania. Bipolar 1 has big manias that by definition cause a disruption in functioning. Bipolar type 2 has small manias, what we call hypomania, that by definition do not cause a problem in functioning. And what we'll see with patients with bipolar 2 is that they have cycles of depression that are significant, right? So a depressive episode that causes definitive problems in their ability to function and significant amount of distress that come and they go. And they are often misdiagnosed as depression. It's not uncommon that, the last figures that I had seen, 7 years from the first time someone gets treatment for their depression before someone figures out that what they're dealing with is really bipolar type 2. And what's important about that is that when we treat patients with bipolar 2 with antidepressants, they either find that the antidepressants work briefly and then stop working, or the antidepressants can make them worse, more depressed, more suicidal, more anxiety, more insomnia, or that they just don't work. What's the treatment for bipolar or bipolar type 2? It's to have a foundation of mood stabilizers on board. And mood stabilizers are medicines that have a couple of different categories, but they help to prevent the mania. Some of them, so what we say is stabilize from above, mania, stabilize from below. Some medications do one, some do both, some do, just from above or just from below. But the kinds of medicines we're talking about, number one is lithium, which is a medicine kind of all by itself. It's an older medication, it's an incredibly effective medication, and it is still probably underutilized. The second group of mood stabilizers are anticonvulsants. So Depakote is a classic one, Tegretol or carbamazepine, Trileptal. These are all anticonvulsants. A medication that is particularly useful in bipolar type 2 is lamotrigine or Lamictal. It stabilizes from below. It works as a very effective antidepressant, not so helpful with mania. And then the last group of medications are the atypical antipsychotic medications. They are all very effective medications. Side effect burden can be a little bit high with some of those. Currently, transcranial magnetic stimulation is being looked at as a potentially helpful treatment modality with bipolar depression. It is not FDA cleared. There's no insurance company that's going to pay for TMS for bipolar disorder, but there's a lot of evidence supporting the use of TMS in bipolar depression.